Imagine what it would be like to struggle with severe depression, have suicidal thoughts, be severely underweight, and unable to seek help. That is what happened to not one, but many of my friends when I was in treatment for my mental illness. Mental illness has been a rising issue in the world for many years now. According to the National Alliance on Mental Illness, 19.1% of adults experienced a mental health issue in the US, which is equivalent to 1 in 5 Americans. However, among all those people, only about 43.3% of them received treatment in 2018. That leaves more than half of people struggling with mental illness in complete silence. The US alone is also one of the most developed countries in the world for mental health care, whereas according to the World Health Organization, almost half the countries in the world do not have programs or policies to help cope with the rising issue of brain-related disabilities. These statistics are absolutely shocking alone, and even for someone who's been immersed in the mental health support culture for a long time, I did not know the issue was nearly this severe. Just like many other people, having access to proper treatment was not easy for me. I had to shift from one facility to the next during my 2 years of treatment. My insurance was constantly waiting to kick me out, despite how I was doing mentally. However, I was one of the lucky ones. With the chance to have undergone professional treatment, let alone even have an insurance company that covers mental health care, I was very fortunate. Nevertheless, I did have to experience many people around me struggle immensely with the process and not be able to pursue recovery. Mental illness has been around forever, yet has only recently been considered an actual health concern. The book, Better But Not Well, which I have here, written by world-renowned doctors Richard G. Frank and Sherry Glide, explores the mental health policy since the 1950s in the US and its development. It discusses the cruel systems of treatment that were in place throughout history and what has been improved. In the 1840s in America, people who had mental illnesses were placed in institutions resembling jails. In these facilities, patients were tied to their beds and could not leave, no matter how much they might have desperately wanted to. In addition, some of these facilities had terrible procedural rules that allowed patients to be treated in inhumane ways. It was thought that the patient had chosen this life of insanity and needed to decide to change their ways. They needed to want to change in order for their illness to go away. Can someone with diabetes decide they don't want to be diabetic anymore? In the 1950s to 1960s, however, a wave of deinstitutionalization began, where patients were moved from psychiatric hospitals with horrible systems to less restrictive residential settings or outpatient care. This also sparked the development of psychiatric drugs, which revolutionized the lives of people with mental illness. The Wellstone and Domenici Mental Health Parity Edition Equity Act was passed in 2008, which assured that insurances providing coverage for mental health could not put any sort of limitations that aren't equal to the ones of physical health in them. Can you believe that it took that long to begin implementing equality between physical and mental health in mental health care in the healthcare system? Why is it that one will confidently seek help for their injuries and their physical health issues, but won't do the same for their mental health? And why is it that only some insurance companies cover mental illness in the first place? Society has imposed this huge stigma on mental health. According to a research study conducted by Inside the ADHD Mind, 66% of adolescents with ADHD substantially underreported symptoms because of the shame and embarrassment for mental health stigma. And this isn't only a problem with ADHD, but also with depression, eating disorders, anxiety disorder, bipolar disorder, alcoholism, and many more. For this project, I was fortunate enough to interview Dr. Rakesh Jain, a world-renowned specialized psychiatrist. He gave me wonderful insights on his experience with the industry and how he has seen it change over his 27 years of work. He says that the stigma over mental illness has been reduced and the overall quality of care has improved massively, yet it is not nearly being even close to being where it should be. He discussed the lack of effectiveness in medications and how scientifically there has not been enough evidence in the success of these psychiatric drugs. Psychiatrists do and have been overprescribing medication, as well as not taking an individualistic approach to them like they should be. He said that there is a huge lack in personnel and mental health specialists in the US. New York City is the city with the most psychiatrists per square mile, yet it does not even come close to being enough needed per capita. There are not enough trained specialists in this industry to serve the growing need of them, and there's too much fake information being spread. He also says that technology in this field has remained below average for many years now, with psychologists and psychiatrists being unwilling to communicate via phone or internet. The COVID-19, he says, has forced professionals to pursue treatment virtually, and this is the most progress he's seen in years. Mental health is unique to everyone, and that is partially why it has been very hard to make progress and generalize conclusions in the field. However, taking the easy way out and generalizing treatment is simply not a solution. Mental illness is not for the rich or the privileged. The typical media narrative frames the experience of depression as cutting across all socioeconomic classes, but this ignores the ways our mental health is also directly informed by material conditions, not only our brain chemistry. People on free insurance for the low-income population, like Medicaid in America, are much more likely to be sent home when seeking for mental health care treatment, while people with private insurance are more likely to get taken seriously and evaluated, according to Mark Olsoff, a Columbia University psychiatrist. He further states that the people on Medicaid often go to hospitals in the country that are much less equipped and have to wait in long lines just to be most likely sent home without an evaluation. This happened to many of my friends, and they had to be left struggling without access to proper help. So what can we do from here, you may ask? Although there is progress being made and access to mental health care in the US has improved dramatically, the future generations need to keep fighting for this cause. The overall stigma over mental illness is still very prevalent, and with social media coming up with new, skewed information on the daily, it is very easy to believe things that simply aren't real. Mental illness is not a choice. Just like breaking your leg or catching the flu, one cannot wish for their illness to disappear and it will do so. People cannot be left in silence anymore, and the government needs to implement more care and aid for the mentally ill. Everyone can go through it, and struggling is nothing to be ashamed of. And that's what I really want all of you to take away from this. Let's fight for mental health care and for the rights of our people struggling. Thank you.